gene expert machine in some centers will now integrate the diagnosis of both TB and then the COVID-19. And so when a person visits that center, the person will be tested for both the TB and then COVID-19.
This month, President Muhammadu Buhari accepted a 3-year grant of 890 million from foreign donors to fight HIV, malaria, and tuberculosis. Officials with Stop TB Partnership say they're optimistic that even with the COVID-19 pandemic yet to be tamed, Nigeria will continue to improve levels of tuberculosis diagnosis and treatment. Timothy Obiezu for VOA News, Abuja, Nigeria.
Top U.S. scientists such as Dr. Anthony Fauci are joining hands with community messengers to encourage African Americans to get vaccinated, but the task is challenging. More with VOA's Veronica Balderas Iglesias.
Faith leaders getting vaccinated against COVID-19 at Washington National Cathedral aim to sow trust in Americans, particularly communities of color who have been hard hit by the virus. So says President Joe Biden's chief medical advisor, Dr. Anthony Fauci.
They have essential workers in the community, which puts them into contact with people who might potentially be infected. That's the first thing. The second thing is that once they get infected, they have a higher incidence and prevalence of the underlying comorbidities, which make it more likely that they will actually have a serious outcome from the infection.
Although 81% of Black Americans consider the pandemic a major threat to public health, only 61% want to be inoculated, according to a recent Pew Research survey. Some Maryland residents share the reasonings.
Viruses do mutate, so what's the point of taking one that's probably not even going to be able to take care of the new strand of the virus that they have out now?
I would say there's a side of, I like to call healthy skepticism, because I just don't want to put anything in my body.
There's still going to be skepticism because of the historical nature of how the United States of America has basically experimented on African American people.
The Kaiser Family Foundation reports a consistent pattern across 39 states. Black and Hispanic people are getting vaccinated at lower rates than whites. The foundation blames it on long-standing inequities and access barriers, not just hesitancy. Frontline worker Shandia Young said even trying to learn more about the COVID-19 vaccine from government online sites has been frustrating.
The websites aren't even up and running right. I mean, y'all got to fix your websites for people to really get the real information.
Dr. Fauci told VOA a new and easy access website will be running soon, and other steps are in the works to get vaccines to people of color.
We're now stocking up close to 900 community health centers from HRSA that will be specifically looking to get a greater proportion of minorities. We're putting into the pharmacies doses of vaccines in pharmacies that are located in areas of high density of minorities. We're using mobile units, and we're increasing greatly the number of people that are actually doing the vaccinating.
In the Washington metropolitan area, local governments have partnered with churches to better distribute vaccines to those who've been underserved. And non-religious groups elsewhere are beefing up information drives, stressing the benefits of the shots. But despite all that, healthcare advocate Mike Brown doesn't expect minds to change overnight.
Some people are just still not convinced, and it's because they never really been exposed to a decent healthcare to understand to take care of yourself, to protect yourself, that this thing is serious, because they have no education on well-being.
Kim Harper, who got her first dose of the vaccine, says she just can't understand the reluctance among some fellow African Americans.
The research that created these vaccines was done by a Black woman. So I have people in my own family who will say to me, you shouldn't get that vaccine. And I say to them, this is my life. You can risk your life. I'm not going to risk my life.
Veronica Balderas Iglesias for VOA News, Washington.
Ongoing research is showing that it is likely the coronavirus which causes COVID-19 may be a zoonotic disease that first appeared in bats A team in the Philippines studies diseases carried by bats in hopes of preventing future pandemics. VOA's Arasha Basadi has more.
Nighttime in the Philippines. A team of scientists using nets captures a wild bat which receives an impromptu medical screening. Scientists swab the animal's mouth, take measurements, and inspect the wings.
What we're trying to look into are other strains of coronavirus that have the potential to jump to humans. What are these areas that have the potential to be the ground zero for coronavirus infection?
Bat ecologist Philip Alviola with the University of the Philippines is on the research team studying bats and zoonotic diseases. The very nature of their work puts them at risk of contagion. They use the data collected from health screening bats to create a simulation model.
If we know the virus itself and we know where it came from, we know how to isolate that virus geographically. So we can implement some travel restrictions. We can prevent city-to-city, province-to-province transmission.
The model projects how time, climate, and temperature may affect the transmission of disease from bats to humans. The International Union for Conservation of Nature says there are more than 1,200 species of bats and at least 78 of them live in the Philippines. The World Health Organization and others have been studying whether the coronavirus pandemic started in bats because the virus has a similar makeup to others that the flying mammals are known to carry. Arash Arabasadi, VOA News.
Still to come, a Nigerian non-profit organization seeks to empower more women by equipping them with technology skills. We'll be right back. Welcome back to Africa 54. U.S. lawmakers are taking a new look at a decades-old law that grants U.S. presidents sweeping powers to wage war overseas. Congress may attempt to take back some of that power. VOA's congressional correspondent Catherine Gibson has our report.
For the first time in nearly 2 decades, the congressional authorizations justifying U.S. conflicts in Afghanistan and in Iraq, and then stretch to include engagements ranging from Syria to Yemen to the strike against Iranian General Qasem Soleimani, are under consideration.
Over 20 years, successive administrations have interpreted and reinterpreted the text of that resolution to use it in new countries against an expanding list of loosely connected groups. This process has all but cut Congress out of its fundamental responsibility to decide issues of war and peace.
Under the U.S. Constitution, Congress has the power to declare war, but the 2001 and 2002 authorizations of use of military force gave U.S. presidents broad powers to engage overseas.
Presidents increasingly go it alone and tell Congress the bare minimum about military actions. Presidents and their lawyers look to a 20-year-old authorization of force to justify their actions. If we do nothing, we shouldn't be surprised by the outcome.
That debate revived earlier this month following renewed tensions between the U.S. and Iran. The White House signaling it is willing to work with Congress to repeal those authorizations in favor of a narrower framework.
They should include concrete consequences, like a funding cutoff with a shorter clock. Put the president and executive branch officials on notice from the outset that if they can't get congressional support for their actions, their funding has an expiration date.
Past efforts to repeal the authorizations have met with opposition from presidents on both sides of the aisle, as well as Republican criticism it could hamper the U.S. response to terrorist threats.
We have the same goal here. We may have just a little bit different means of getting about it. We should also avoid dismissive talk of forever wars because it implies that our ongoing counterterrorism engagements are illegal and unnecessary.
As a senator, Biden worked for greater congressional oversight over presidential war powers. Now that he's in the White House, there is a sense Congress can reassert control over one of its most important responsibilities.
There is a fundamental question of leveling with the American public and holding the president accountable for the justification that he or she proposes to provide.
Legislation repealing those decades-old authorizations has already been introduced in the U.S. Senate. Catherine Gibson, VOA News, Washington.
In our technology news, the global advancement of women over the last few years has not gone unnoticed. However, critics say more work remains to be done to reach gender equality in innovation and technology. In Nigeria, a non-profit organization uses innovative approaches to encourage more women to pursue technology careers. For more, Africa 54's technology correspondent Paul Ndiho via Skype spoke to Oreolua Lesi, founder and executive director of the Women's Technology Empowerment Center in Lagos, Nigeria.
Ore Lesi, welcome to Africa 54.
Thank you so much, Paul. I'm happy to be here.
You lead an organization that empowers a lot of women in the field of science and technology. Let's start there. What do you do exactly?
Thank you so much for that question. I run a nonprofit called the Women's Technology Empowerment Center, WTech. It's based in Lagos, Nigeria. And what we do is we equip girls and women with technology skills. So, for instance, programming, building mobile applications, website design, graphic design, robotics. And so we're really trying to get girls interested in technology and technology-related careers and supporting them as they start to pursue careers in technology.
When these young women come to you, or women in general come to you, what are their concerns? What is it they are looking for?
We work with girls in secondary school. So one of our flagship programs is our She Creates Camp, where we are working with girls between the ages of 13 to 17. And there we're helping them build technology skills, helping them to become technology creators, introducing them to role models already in the technology space. So when they come to us, I mean, they're still in school, so they're still open to learning a lot. They don't really have a lot of preconceived notions yet about, oh, tech is for me or tech is not for me.
Are there some examples of success stories of women that have gone through your training who are out there doing their thing?
We've empowered